Hello, and welcome to a brief discussion on aviation medical certification, which is an important part of Academy students planning a long-term career in aviation. When planning your future in an aviation career, such as professional piloting or an air traffic controller, you must understand that periodically you must go and receive a flight physical. The flight physical is given by an individual called an aviation medical examiner, commonly referred to as an AME. An AME is a physician that has an aviation medicine specialty. They have been authorized by the Federal Aviation Administration to proctor these flight physicals. Once again, the premise to our conversation is that good health is absolutely required. We are operating in a complex and dynamic environment that requires not only the knowledge base, but also eye requirements, hearing requirements, general physical overall good health. Although infrequent, every so often we have a student who applies for admission to the academies and they have a medical history or they're on a medication that quite frankly is not aviation approved. Please engage in a dialogue with your aviation champion if there are any concerns, because we need to clarify these issues before starting class and very much so before you begin flight training. All students who are pursuing an aviation degree at the Community College of Beaver County have to pass at least a second-class physical standard. This most befits air traffic controllers and commercial pilots. Generally speaking, they get that physical every 12 calendar months. However, if you are a professional pilot applicant, I highly suggest that when you go to the aviation medical examiner for testing, that you ask the physician to test you under the highest standards. The highest standards of eye requirement and hearing requirements is the first class physical, the physical that airline transport pilots would receive. We do not need the documentation that you can pass that physical exam under first class standards, but wouldn't it be nice prior to starting the program knowing that you can pass the physical that's required for employment later on in your career? The exam itself is a general physical. It's an eye check, hearing check, lungs, heart, a urine screen. Generally speaking, they will provide you with the documentation on that day, unless they find a physical issue that warrants additional testing. Again, if there's any questions with regards to physical standards, please feel free to reach out to your aviation champion.